Sinus infection, known as sinusitis, is a major health problem. It affects 31 million people in the United States. Americans spend more than $1 billion each year on over-the-counter medications to treat it. Sinus infections are responsible for 16 million doctor visits and $150 million spent on prescription medications. People who have allergies, asthma, structural blockages in the nose or sinuses, or people with weak immune systems are at greater risk. In this video, we share our top tips to cure a sinus infection. Any extra resources or information will be included in the description, so make sure to check it out. Our first tip is antibiotics. Antibiotics are standard treatments for bacterial sinus infections. Antibiotics are usually taken from 3 to 28 days depending on the type of antibiotic. Because the sinuses are deep-seated in the bones and blood supply is limited, longer treatments may be prescribed for people with longer-lasting or severe cases. Overuse and abuse of antibiotics have been causing a major increase in antibiotic resistance. Therefore, patients with sinus symptoms should consider taking an antibiotic only if symptoms, including discolored nasal discharge, persist beyond 7 to 10 days. Antibiotics help eliminate a sinus infection by attacking the bacteria that cause it. But until the drugs take effect, they do not do much to alleviate symptoms. Some over-the-counter medications can help provide relief. Our second tip is nasal decongestant sprays. Topical nasal decongestants can be helpful if used for no more than 3 to 4 days. These medications shrink swollen nasal passages, facilitating the flow of drainage from the sinuses. Overuse of topical nasal decongestants can result in a dependent condition, which the nasal passages swell shut, called rebound phenomenon. Our third tip is antihistamines. Antihistamines block inflammation caused by an allergic reaction, so they can help to fight symptoms of allergies that can lead to swollen nasal and sinus passages. Our fourth tip is nasal decongestants and antihistamines. Over-the-counter combination drugs should be used with caution. Some of these drugs contain drying agents that can thicken mucus. Only use them when prescribed by your allergist. Our fifth tip is topical nasal corticosteroids. These prescription nasal sprays prevent and reverse inflammation and swelling in the nasal passages and sinus openings, addressing the biggest problem associated with sinus infection. Topical nasal corticosteroid sprays are also effective in shrinking and preventing the return of nasal polyps. These sprays at the normal dose are not absorbed into the bloodstream and could be used over long periods of time without developing addiction. And our final tip is surgery. If drug therapies have failed, surgery may be recommended as a last resort. It is usually performed by an otolaryngologist. Anatomical defects are the most common target of surgery. Your surgeon can fix defects in the bones separating the nasal passages, remove nasal polyps, and open up closed passages. Sinus surgery is performed under either local or general anesthesia, and patients often go home on the same day. So that sums up our top tips for curing a sinus infection. If you found any of it useful, then hit that like button, and if you're new here, feel free to subscribe.